our webinar today. Our webinar is called Landing Your Global Health Internship, Tips from a Recruiter and Interns. My name is Joyce Prescott, and I'm the lead for Recruitment and Diversity for the Global Health Fellows Program 2 of Public Health Institute. And I'm delighted to welcome you all today. We are actually broadcasting from our Washington, D.C. and our Oakland, California offices, as well as we have interns working remotely from Atlanta and Los Angeles. We have hundreds of you today registered for this webinar, and we're really, really excited. Many of our colleagues have just come back from doing a lot of outreach. We've been visiting colleges and universities throughout the country, particularly historic Black colleges and universities and Hispanic serving institutions, and talking to students and faculty about the Global Health Fellows Program 2 opportunities and how students can best position themselves in pursuing their global health careers. And we're pleased that so many of you have registered today and are with us. So welcome to the webinar. Let's start with a few housekeeping items. First of all, if you have any technical difficulties at any time during our program, please call the number on the screen for assistance. We have our technical assistance people here, and they can answer questions for you. You can use the Q&A function to submit your questions on any technical issues. If you look at the bottom of the right-hand corner of your screen, you'll see the Q&A, and you can just type your questions right there. Also, we're going to give you the opportunity to participate in polls by selecting your answer and just clicking Submit. Please note that these materials were written by the Global Health Fellows Program 2. We are not USAID. We have a cooperative agreement with the United States Agency for International Development, and all of the content that you are going to see today was written by the Global Health Fellows Program and does not represent the views of the government. We have a Q&A feature, and at any time during this presentation, when you think of a question you'd like to ask us, please submit it, and all you have to do is type it in the Q&A box, and we will be having a Q&A session at the end of our presentation for the last 30 minutes. So please feel free to ask questions. So let's talk about our agenda for the next hour and a half. We're going to have a brief introduction and talk about USAID and the Global Health Fellows Program, and an overview done by Kendall Snyder, who is a coordinator for our internship program. Then we're going to hear from 3 different interns about their experiences at USAID. And finally, we're going to talk to you about what employers look for and how you can best position yourself for an internship position. And as I mentioned, we're going to answer all of your questions. So the presenters today are Kendall Snyder, who is the Recruitment and Participant Support Coordinator for the program, Nicole Brown, who is an intern in the she's a Commodity Security and Logistics intern in the Office of Population and Reproductive Health at the Bureau for Global Health, Cheryl Chase. Nicole is in Los Angeles, by the way. Cheryl is the HIV testing and counseling intern for the Office of HIV/AIDS, Bureau of Global Health, and she is calling in from Atlanta. And Selamawit Desta is a high impact and family planning practices intern with the Office of Population and Reproductive Health, and she's calling in from our Washington, D.C. office. So here is our polling feature. We get to ask you some questions, and you get to answer, and we will show you the answers as we go through the presentation. And the first question that we'd like to know a little bit about who's on the phone. So if you could tell us what your current level of education is, whether you're enrolled in an undergraduate program, a bachelor's degree, graduate program, master's, or higher, or anything else, and you can put that in the Q&A session. So please take a few minutes to tell us about your education level. Okay, and we'll be reporting on that in just a few minutes. But now I'd like to introduce Kendall. Kendall, are you ready to tell us about the Global Health Fellows Program 2 and particularly the internship program?
I am indeed. Thank you very much, Joyce. I am very excited to be here today, and I hope to offer you all a very useful picture of the Global Health Fellows Program 2 and what it has to offer to those of you who are beginning your careers. So starting off, I guess probably one of the first questions that you have is, what is the Global Health Fellows Program 2, and how does it fit in the larger goals of the U.S. Agency for International Development and the work being done in Washington, D.C. and overseas? So we like to start off with this slide. This is our People Matter slide. And so simply put, the Global Health programs within all of USAID represent the commitment to prevent suffering, save lives, and create a brighter future for families in the developing world. By finding the best people and helping them to grow in their work as global health professionals, GHFP2 contributes to its client's goal, USAID's goal, and to the health of people in developing countries around the world. So looking a little bit further, USAID at a glance. So where does it work and what does it do? USAID is the largest development organization in the world. It serves as a development arm of the U.S. government and implements the U.S. government's foreign assistance agenda. Within USAID, global health is actually the largest portfolio. It exceeds $5.5 billion. That was as recent as fiscal year 2011. And within the broad field of global health, USAID divides its work into environmental health, family planning, health systems, HIV/AIDS, infectious diseases, maternal and child health, and nutrition. And GHFP2 works with USAID in all of these areas and even more. Virtually no area of the world is outside of the agency's work, as you can see from this map. It covers all continents except Antarctica. The Global Health Fellows Program 2 is one of several initiatives that allows USAID to access diverse talent to address its long and short-term needs. GHFP2 is unique in its combination of opportunities available and the professional and career development we offer to individuals participating in our program. So in general, GHFP2 interns and fellows are global health professionals at different stages in their careers. They're motivated, technically excellent, and representative of the diversity of the American people and committed to USAID success in key global health areas. You'll hear us talk about fellows and interns quite a bit. Fellows will typically serve as the OSM, or the on-site manager, we use the term OSM, who gives the intern their daily work, and you'll hear more about this later. Whereas we also have a GHFP2 supervisor who serves as the GHFP2 arm as the direct and legal supervisor of our interns. So now looking a little deep into GHFP2, and PHI. So the Global Health Fellows Program 2. Although our fellows and interns work within USAID, they are employees of the Public Health Institute, the lead partner in GHFP2. Headquartered in Oakland, California, PHI, the Public Health Institute, employs over 700 people implementing more than 200 different projects ranging from alcohol research to disability programming to international leadership development. Our GHFP2 partners include, as you can see on this slide, Management Systems International, or MSI, who help support fellows' professional development, and CDC Development Solutions, whose programming focuses on short-term private sector fellowships. More information about these partners can be found on our website. One of GHFP2's collaborating organizations is GlobeMed. GlobeMed reaches over 2,000 undergraduates a year through its 46 university-based student-led chapters. If there's a GlobeMed chapter at your school, it's a great place that we recommend to start exploring your career options in the field of global health. So as our name indicates, we are in the second iteration of the Global Health Fellows Program. The first was from 2006 to 2011. We started another 5 years this past October, so I guess about a year now, and we engage in activities that span the geographic reach of the agency. We do this primarily through internships and fellowships, as I mentioned a bit ago, and by providing professional development and career management services to those who participate in our program. So here's a snapshot of our current interns and fellows and how they're broken down. As you can see, they are a very diverse group of individuals, ranging in age from 18 to 39 years old for the interns and 26 to 67 years old for the fellows. They possess a wide variety of technical interests and degrees to support those technical interests, as you can see. It's not just MPHs. This summer, we have interns working in the areas of HIV prevention, HIV/AIDS care and treatment, orphans and vulnerable children, tuberculosis, monitoring and evaluation, and those are just a few of the several technical areas that we have this year, or had this past summer. Of note is that while all work in global health, not everyone has a master's in public health. Many of our interns and fellows come to the program having studied business, social work, medicine, nursing, public administration, and again, many others. More important than the degree's focus is the passion and enthusiasm for and the skills in global health technical areas that each individual brings. So currently we have around 120 fellows, I think it's about 117 now, and we recently had our cohort of summer interns on the program working with USAID in Washington, D.C. We also host on-demand internships throughout the year. We also have placements with GlobeMed which are open to undergraduates, and the USAID internships each have specific requirements ranging from completion of an undergraduate degree to enrollment in a graduate program. These positions are competitive, and a little later on in the presentation, Joyce will be speaking about how to present yourself within the context of your application materials. Fellowships are at all levels, and the jumping off point for a junior level fellowship is an MPH or similar degree, plus 1 or 2 years of relevant experience. Each fellowship has its own very specific scope of work beyond those initial requirements. The fellowships are for 2 years, often with an option to extend for an additional 2 years with placements in Washington, D.C. and overseas. U.S. citizenship or permanent resident status is also required for all of our positions. As you can see, fellows and interns have worked in a variety of locations. Countries listed in regular text are those where we've had or currently have fellows, while those countries in red are where we've had both fellows and interns. Lastly, countries listed in bold, Senegal and India, are those where we've had interns only. So a few technical specialties, or a sample of them. Areas that both interns and fellows have worked in are varied. This list is not exhaustive, the list that we have up here on the slide. We currently have fellows working on animal to human transmission of disease, voluntary medical male circumcision, behavior change communications, pandemic threats, and other areas that aren't listed on here. If it's done in global health, chances are we do have a fellow or an intern who has worked on it. And on that note, before turning the presentation over to Joyce, there are a couple of things I'd like to mention. As part of the program's commitment to developing the next generation of global health professionals, GHFP2 seeks to reach out to diverse populations that may not have had the opportunity to become involved in global health. By doing this, we hope to bring new perspectives and ideas to the field, thus enhancing all of the work that we've been doing and will be done. And on that note, Joyce, I will hand it back over to you.
Thank you, Kendall. Now I'd like to introduce Nicole Brown, who is our Commodity Security and Logistics Intern in the Office of Population and Reproductive Health. Nicole, before you start your presentation, will you tell us a little bit about your background?
Sure, I'd love to. Hi, everybody. My name is Mikael Brown, and I was one of 2 Commodity Security and Logistics interns in the Population and Reproductive Health Office at USAID this past summer. And I did my undergraduate degree in Industrial and Systems Engineering at Georgia Tech in Atlanta, where I'm from. And I also got my master's under the same department at Georgia Tech, but with a focus in health systems. I am currently calling in from Los Angeles, as was mentioned before. I am a doctoral student in the epidemiology program at the University of Southern California. And prior to the GHFP2 internship program, I had very little public health and global health experience. I had about a semester's worth of my epidemiology program under my belt, and I had a lot of knowledge about hospitals and clinics here in the United States, since that's where the majority of my internships and research experiences were based. So GHFP2 gave me a really good opportunity to bridge that gap and apply what I had learned here domestically into the global health arena with USAID. And through my work at USAID, I worked with the Division of Commodity Security and Logistics, and the main goal of that division was to ensure that everyone in our partner countries who wanted to access contraception was able to get the method that they wanted when they wanted it. And toward that goal, I worked on 3 main projects during my summer internship. The first one was looking at the shipment network for our reproductive health commodities and looking at where our warehouses currently are, if there were any opportunities to realign our shipment network to achieve savings. So I was looking at holding costs, freight costs, et cetera. If there are any industrial engineers on the line, then you know that's a classic network optimization problem. So I was excited to use some of my undergraduate background at USAID. And the second project that I worked on was looking at how USAID donated contraceptives impacted prevalence rates in the priority countries that we work with. So I used statistical software to analyze demographic health survey responses from people in the countries that we serve, as well as reproductive health survey responses and some of the internal logistics data that we collected in partnership with one of USAID's contractors, John Snow Incorporated. And through that aspect of my internship, I was able to work really closely with the folks at John Snow Incorporated, and that gave me insight into the contractor-agency relationship and just see how both both organizations were able to work together to achieve a common goal. And lastly, the third main project that I worked on this summer was creating a supply chain evaluation tool. And that tool was made to be used inside our division just to make sure that we were offering the best supply chain service to our partner countries as possible. And also there are plans to roll out the tool to some of the other donor agencies that work with our partner countries. Those agencies include the United Nations Population Fund, the UK Department for International Development, and a few others. So it's nice to know that something that I made has the potential to have a really broad impact in several different agencies. And through my time at USAID, I can honestly say all the experience that I had showed me that I really love the agency and the GHSP2 program. I've had a lot of internships over the years in several different areas, and there's really something special about this past internship that I've had. I've never worked with a group of people who were more friendly and more conscientious and just more motivated about the work that they do. Every single person, when they show up at the office at USAID, you can see that they really care about what they're doing, but they also care about the work that other people in the agency are doing. Even as interns, if we had questions or concerns about how to navigate our projects or just the direction that we wanted to move in, anyone was more than willing to sit down with us for a quick meeting and kind of offer some guidance. And the culture that they have at USAID is really a learning culture. Every single day there's an email blast that goes out to every single person in the agency, and it has nothing in the email blast except for training opportunities, brown bag seminars, conferences, and anyone who wants to go can take advantage of pretty much any opportunity that's there that day. As long as it doesn't interfere with the regular work that you have scheduled, you can go. So to that end, as an intern, I was able to go to a week-long training with one of our contractors where I was able to supplement the supply chain knowledge that I had from the public sector and bring that into the global sector and learn how some of the things that are used in the private sector are applied within global health. And all in all, I can say it was a wonderful internship experience, mostly because you can tell that USAID and the Global Health Fellows Program really invest in the interns. A lot of the interns this summer had the opportunity to travel abroad for pretty long periods of time. We worked on meaningful projects. We weren't just sitting, in the back of an office somewhere filing papers the whole time. Everything that the interns did had some sort of impact, whether it was within the realm of HIV or maternal and child health. There was impact to every single thing that we did. And lastly, we were offered one-on-one career advice. We got to sit down with folks at the GHSP2 office and to talk about what we wanted to do and the direction that we wanted our careers to take, and they worked with us to identify other agencies that we could potentially work for, opportunities within USAID that we could work for. They helped us to craft our resume in a way that made us the most appealing to the global health arena. And it was just a great internship experience. That sums up my slides. I'm going to stay on the line so that I can answer any questions you guys might have at the end. Thank you.
Thank you very much, Nicole. That was very, very informative. Now we're going to hear from Cheryl Chase. Cheryl Case. Cheryl is the HIV testing and counseling intern in the Office of HIV/AIDS in the Washington, D.C. office. So Cheryl, tell us a little bit about your background before you came to Global Health Fellows Program.
Yeah, well, greetings from Atlanta. Thank you so much, Joyce. So just to give you a little background of my personal story, my first step towards global health really began at my bachelor's degree in international economics. It was here that I got passionate about development and became interested in USAID. As I first learned about economic development models, I realized I really wanted to work with the people in my supply and demand curves, specifically in health. I got interested in community development and grassroots organizations, and as a graduate student, I tried to be a part of as many research studies as I could. I worked as a graduate research assistant, did HIV/AIDS testing and counseling, volunteered with community organizations, and picked up a lot of good practical research skills. During this season of life, I just tried to learn anything and everything to improve my research skills. So I volunteered with StoryCorps and transcribed interviews, facilitating oral histories, and entered data for the National Archives. I took GIS classes to make local maps for local communities, and just tried to learn as many hard skills and soft skills as I could. And I just really fell in love with research and the possibilities that it opened up to get to know communities. About halfway through the first year of my PhD program, I started looking for opportunities to grow and have some work experience, and just kept thinking about clinical degrees in the back of my mind. And I took a look for some summer internships, and I found a job posting for the HIV testing and counseling internship with GHFP2, and it seemed like a great fit and an opportunity to learn. When I applied for this internship, I was really excited about the opportunity to work at US because it had kind of always been a dream, and it really was remarkable. It's given me an opportunity to explore global health, build my skills, and since this past June, I just feel like I've been drinking from a fire hose. As an intern, there's just not a day that goes by that I don't learn something new or have an opportunity to just explore more of global health. I guess to give you a snapshot of what I do every day, this is what you all really want to know, is I attend a lot of meetings in person, but also over the phone since I'm working from Atlanta. Telework is something that happens a lot at USAID, and most of the people I correspond with are either working remotely overseas or from other cities here in the U.S. So it's just a new research skill to learn how to interact with people on webinars and teleconferences more usually. It's just a great opportunity to just get to learn from contractors or program partners, other agencies within USAID. Those meetings that I've gotten to attend have been technical working group meetings with CDC and also USAID partners. And I also do a lot of reading and writing. I read a ridiculous amount of articles every day. There's always something to read, a new guideline, a new published study, and there's always a lot of writing, a protocol to write, a concept note, an abstract to submit, and talking points to prepare. Data packaging is something I do a lot of as well. This is for a lot of my work on systematic reviews or other research tasks. It's really critical to whip out a table or a flow chart or a one-sheeter for an email or a meeting. So Excel has really helped me to prepare and add my data points quickly. Tight deadlines, there's always an assignment in my box. It takes a lot of time management, communication, and effort to get the work done in time for the deadline. And cutting-edge research. I kind of have a neat story. When I was training as an HIV testing and tester and counselor back in Atlanta, I remembered our trainer bringing up self-testing. I was really curious, and when I got to USAID this summer, I brought it up and asked a question. And then a few weeks later, the FDA approved the HIV self-test for retail, actually this October. The next thing I knew, I was at the FDA talking to the leaders on the project, and then I was doing a systematic review, and then giving data points and briefings, and it's been quite a ride, and I feel very privileged. So here's just a snapshot of some of the work that I've gotten to do. I can't go into too many details, but I am really excited about this brown bag coming up where Dr. Elliott Cowan is coming to talk about the approval process of the first HIV test. And that's going to a webinar internal to USAID. And I'm just really excited just to continue to be a part of that process, as well as the reviews and getting to present with my supervisors and managers. But just as Nicole was saying, this internship is just a really great opportunity to build skills and be mentored and get networked. And I, for me, have just learned a lot about meeting management, communication, how to boil research points down, how to manage up in terms of building relationships with your supervisors and the people that you work with, and just really feel like my technical skills have just grown in leaps and bounds. I've just learned so much through the GHP brown bags. Jennifer Kirk has done a really great job investing in us. Before this internship, I never used LinkedIn. So that was one area where I really grew, was how to use a LinkedIn profile and how to connect with program partners or people that I would meet at meetings in technical working groups. And I really have a fabulous supervisor. I can't say it enough. They check me every day. They invest in me, mentor me, help me figure out what's next in terms of steps towards a career. I'm just really thankful for that investment because, as Nicole said too, I've had lots of internships where that wasn't part of it, where you're kind of on your own, and this is definitely not like that. I have just been extremely grateful for the opportunity and have nothing but good things to say. So that's the end of my slides. Thank you so much for the opportunity.
Thank you, Cheryl. That was very informative. And next up, we have Salaam.
Sorry, wait one
Slide up.
Hi. Hello, everybody. My name is Selamawit Desta, but I usually go by Salaam. And I'm also interning as and I'll be echoing a lot of what Nicole and Cheryl have been saying about the internship, that it's a great, great, great experience. And if you're fortunate enough to be a part of it, I know you all will be as enthusiastic as we all are. So I'll tell you a little bit about myself. I have a bachelor's from Fordham University with a dual concentration in economics and French, and a master's in international affairs from Columbia University. And I'm now at the Bloomberg School at Johns Hopkins pursuing a master's of science in public health. Unlike Nicole and Cheryl, I do have some international public health experience. I was a peer HIV/AIDS educator, in Tanzania for 2 years, and I worked for about 6 months in an orphanage in Ethiopia. I also served on the board for about 5 years for a non-for-profit HIV/AIDS organization based in the U.S. Virgin Islands, which is one of my homes away from home, what I consider my hometown, but I'm a global citizen, and that's another story in and of itself. But so I'll tell you a little bit about what I do at the internship. I've worked on 2 white papers, one on contraceptive. Oh, I'm sorry. I should say where I'm working. I'm a high-impact family planning practices intern working with the Office of Population and Reproductive Health. So a lot of family planning, a lot of looking at the different methods, and the method mix is what I've been concentrating my time on here. And I wrote 2 papers, white papers, one on contraceptive method mix in the USAID priority countries, which there are 24 of. I've analyzed and presented DHS data on the method mix, and I've also developing a white paper on dual protection. And I'm also gathering literature on scale-up efforts in family planning, and we'll begin a literature review. So I have kind of larger deliverables, such as these that I've just mentioned, and then the smaller kind of day-to-day activities like fact-checking, a number of briefs, and providing logistic support to meetings, taking meeting notes. But a considerable amount of time considerable amount of things that I do at GHFP, it's really, really, an excellent learning experience, because my on-site manager really involves me in a lot of the higher level discussions about not only doing this research, but seeing how it can be applied in the real world. And so I have, as the other interns say, a number of opportunities to actually do real world stuff and see how that translates, and see how decisions are made where the government chooses to invest money, and where it chooses to prioritize global health initiatives, which is an amazing experience, because coming from school, we have so much of the research base, and we understand a lot of what works on the research side, but seeing that transition from evidence into actual practice is amazing. And being in these meetings and understanding how decisions get made, and understanding what the process is for things to actually get done, it's an amazing level of insight to have. And the wonderful part of the experience is, people don't consider you as just an intern, kind of a lower level on the totem pole, but they respect what you have to say, they value that, and they take it into consideration, which is amazing, to be able to have some say, and hopefully a little bit of sway into how things are planned and how major decisions are made, and that is incredibly gratifying. But it's just humbling to be not considered an equal, but somebody who is invited to a table where these large level decisions are made. And so a typical day of an intern, it's kind of hard to say, because we all work in different divisions and different offices and have different levels of technical expertise. But what I will say is that we do attend a lot of meetings. I think Cheryl being teleworking from Atlanta, and Nicole working from Los Angeles, we still have the opportunity to call into a lot of meetings. And these are just great networking opportunities for all of us, to get to know the people within our divisions, but also across the division and across USAID office. So there's a number of networking opportunities, and meetings are just one of them. Also, internships can be very email heavy, and the advantages to that is we're allowed a flexible work schedule, and you can telework, work from home. You can continue your internship, if you're commuting from a faraway place. I telework 2 days out of the work week, and it's incredibly helpful to me as I continue with school and deal with personal obligations as well. So there's a lot of opportunities there. But the benefits of this experience for me are just amazing. You have a lot of professional development opportunities, both at GHFP. There's a lot of brown bags, a number of networking opportunities, both within GHFP and USAID staff. They take their time to provide you with support. There's so much structure here. There's so much guidance, and it's not somebody holding your hand and walking you through an experience like you're a child, but providing you with the structure and the support that you need to not only excel in your internship while you're here, but also continue to be invested in public health and continue to develop your career, which is amazing. I've had a number of internships with larger organizations, and this by far has been the best internship. I feel so blessed and so thankful to have been selected and to have been a part of the work that USAID does. As well, my on-site manager helps me develop. When we're coming up with ideas for projects to do, she consults with me and she asks me what my career interests are, what my research interests are, and she doesn't just throw projects on me. We decide through a collaborative process what's important for me to not only in my time here at USAID, but something significant to put on my resume to build a career towards. And that, just the fact that she will take that time to sit down and go through that stuff with me says so much about how much they value the people that they work with, whether you're an intern or a fellow or a colleague at the same, a peer. So the people are incredibly knowledgeable, incredibly humble, and accessible and kind. You'll be amazed at how much mutual respect people have here for each other, and how truly passionate they are for global health. And it's so amazing to start your career for us interns and to see such incredible role models. And lastly, what I wanted to say is it's not only about USAID. USAID works with a lot of implementing partners all over the country. And in fact, in DC is where the technical arm of USAID really sits, and the work on the ground gets done a lot by these implementing partners. And I think I speak for a lot of the interns. We have a number of opportunities to interact with these implementing partners, which is also great for networking opportunities and future employment opportunities. So, if you all are fortunate enough to be in this position, I know that you'll find this opportunity to be just life-changing and truly amazing opportunity. And I participated in the webinar last year, and I was very appreciative of the advice that was given by the interns. But in the slides coming up where they talk about what to put in your resume and walk you through some of the basics of the application process, I found that to be very, very helpful. So I'll pass it on to Joyce, I think, next to go over what's
Great.
The next couple of slides.
Thank you, Salaam, and thank you for that endorsement. As you can hear from all three of our interns, there's a tremendous amount of passion for global health and for the experience that they're having at USAID. Please also note they came from a variety of different places in terms of education and experience and even geographic distance. Okay, so now the next thing that we're going to do is another poll. So we'd like to hear from you about what is your professional experience. Where are you in terms of your education and experience? Are you working in global health? Are you currently working in domestic health or a different field? Are you still in school or not currently working or in school or other? So let us know where you're coming from. and that'll help us and help inform some of the next discussion. I'll give you a few minutes to do that. And as you do that, I will let you know that this year, we expect to have Washington, D.C.-based fellowships. The announcements come out actually first week of December. We will be posting them on our websites. The application period ends in late January. It's very important that you watch for that end date because it is a final end date. And the interns actually start in late May or early June for about 12 weeks. They are compensated, and we will have information on our website. And also, if you're on our e-list, you will be receiving the announcements directly to your email. Okay, so let's talk about, are you ready for a commitment that will move you to the next level in terms of your global health experience? So we want to talk to you a little bit about our application process and how it's different from maybe other internships that you may have applied for in the past. At the Global Health Fellows Program, too, our mission is to help develop the next generation of global health professionals that represent the diversity of the American people. So we're not just looking at people that went to great colleges. We're looking for the total person. And our application asks you questions about your experience, your life challenges, things that you have had to overcome in terms of your background experience, your credentials, but we're looking for the whole person, and we're looking for people who have passion and interest in global health and want that first international experience. Now, there's a couple of different roads that you can take to get a career in global health, and there's more than one way to do it. The traditional, we obviously process a lot of applications, both for internships and fellowships. And the traditional path to get into global health is somebody gets an undergraduate degree in global health. They maybe study abroad for a semester. They may have an overseas internship and then go to Peace Corps. And that really sets them up for a good position in global health. But not everybody has that opportunity to do that because going overseas for internships and going overseas for unpaid volunteer experiences, not everybody has that economic privilege. So we'd like to look at a different way that you can get into global health. Because every time we go out to a career fair, every time we do an informational interview, we hear the same question: how do I get international experience if I don't? How do I get a job in international health if I don't already have the international experience? Not everybody can afford to go overseas and go trekking in Nepal or do that Peace Corps internship. So what we'd like to talk to you today is about things that you can do to get experience that that is respected and is relevant to a career in global health. First of all, if you have a degree in just health sciences or health-related field, and you decide and you want to get some experience in terms of getting a career in global health, what we recommend that people do is volunteer. If you live, work, or volunteer in an under-resourced city in the United States today, a major metropolitan city, you are going to have many of the same experiences that you would have in a developing country. Unfortunately, as you know, there are many health inequities in our own country, and having that experience, volunteering maybe at an AIDS clinic, maybe a reproductive health or family planning clinic, a pediatric clinic, whatever your interest is, working with refugees in the inner cities, these are the types of experiences that we look at very, very seriously, and we see that connection of that experience to working in a developing country. So successful applicants in our program have not necessarily all had international experience. Some have, some haven't. We look for people that have that domestic experience, have the passion to use that experience in the global arena. So if you're thinking of applying for an internship with the Global Health Fellows Program this summer, there's still time. If you're in school now and you want to volunteer in any kind of a health-related clinic or something to do with what your passion is about, that experience is going to translate loud and clear on your application. As I mentioned, our application process looks at the whole person. We ask essay questions. We ask you to tell us about your interest in global health and where you've been and what your background is and why you want to be in global health. In addition, now you heard all of the 3 interns talked about their experience in Washington, D.C. this summer, but we also have overseas internships that are sponsored through GlobeMed, which is our partner, as Kendall indicated. And GlobeMed has overseas internships for undergraduates. It is a student-led organization on 50 chapters, 50 campuses throughout the country. And what they do is they match up the chapter with a developing country organization, a small NGO, and interns are selected for 3 to 8 week summer internships overseas. And we're going to fund at least 65 of these interns for the summer. They will receive scholarships, and they're needs-based. So they are directly for underrepresented individuals in the global health field. So if you're a student at a university right now, what you might want to do is look at the GlobeMed website, see if they have a chapter, and if they don't, you can find out about how to start one. So questions to ask yourself as you're preparing to apply for an internship. You need to ask yourself, why am I interested in global health? Now, the reason I'm saying ask yourself, because before you apply, you really have to have this idea formulated in your mind in a very persuasive answer, because you're going to have to answer questions both on the internship application and if you are selected for an interview about why you're interested. It could be to get a wider perspective on a specific health issue that you're interested in, or maybe a family history issue, or we want to know why you're interested in global health, and you'll have that opportunity to explain that in the essay. Also, what do you hope to gain, and what do you hope to contribute? It's kind of a give and get situation. You each have unique skills and experience from your own background and that you want to explain in your essays, and you also want to talk about what you are looking to get. It's not a one-way street here. The internship, as you've heard, gives you a wonderful opportunity to contribute your skills, your background, and your experience and your passion, but it also gets you a tremendous amount of influence. It gives you a network that you can build your career on. And so, and how will this experience help you to clarify or achieve your longer-term goals? At one level, you may be interested because you want to make a difference in the world. Most of the internship applications we read are from people who really have a passion. They want to change things. They want to help people. They want to advocate for health care in underserved communities. But you also want to be aware of how that experience is going to help you to move to your next career opportunity. Now, how do you stand out? It's a really, really big crowd. Last year we had over 1,300 applications for 25 internships. That's not to discourage you, it's just to let you know it is very competitive. They're wonderful opportunities, and unfortunately, they are limited in number. So how do you stand out? What can you do to make your application more competitive? We're going to talk a little bit about that. First of all, do follow the instructions on the website. We have a great website and with lots of information, so you really want to pay attention. Take care when you're reading the scope of work and the requirements for the position and the due dates. The due date is really important. When we have an 8-week period of when we're receiving applications, and then we close it and we have to start reviewing them. Focus on your passion. Apply for the position that best meets what you want to do in global health. Be sincere. Don't over-exaggerate your experience. Again, for intern positions, we don't expect you to have been the program director of a major health program. We just want you to tell us your role, what you've been able to do in your volunteer work and your school research. Those are the things that we're looking for. Tell us about your background. If you are living, working, or volunteering in an underserved community, that's important for us to know, because you will be able to make that connection to the developing countries and the health issues that are very similar. Tailor your essays to the internship that you're applying for. Each applicant is asked to answer some general questions about your background, your experience, the challenges you've overcome, about you. And then there's a question about the specific internship that you're applying for. Make sure you pay special attention to that question. It's interesting, we read, as you know, hundreds of these applications, and it's interesting that some people don't take the time to really stand out in that last question, and that it's probably one of the major questions that we consider. Also, talk about what you want to gain, and don't just focus on what you want to get. So many of us, we get a lot of applications that tell us what the applicant wants from the internship. Tell us what you will give. You have a unique experience. All of us do. Tell us about that. There's some passion in you that has made you decide to go into global health or a related field, and we want to hear about that. So, again, the essays are extremely important. They're read not only by the recruitment staff here, but by the hiring managers, and they're given great weight and consideration in the process. Research the Global Health Fellows Program and USAID. That will go a long way to frame your application and your responses to the question. USAID has a wonderful website. They've recently updated it. Look at the area that you're interested in interning in, whether it's HIV or maternal and child health. Look up that division. You can read about the projects, the people, and the challenges and the successes that that group has had. So you want to really be informed when you apply. Also, our website. Our website talks about prior interns, their experiences, and it talks about how to apply successfully. Okay. I'm not seeing our polls come up yet, and I wanted to share our poll numbers with you. So let's talk about some don'ts. Obviously, don't stick your hand in an alligator mouth, but when you're applying, don't name drop unless that person's name is relevant to your story and what you've done, because we're not easily impressed. We read a lot of essays, a lot of applications, and as we said earlier, we're looking for the whole person, not who you know. Don't submit a sloppy application. Proofread it, spell check it, and have somebody else proof it for you. It's amazing. Sometimes we all rely on spell check, but it doesn't always do the trick. Again, reading, writing, research, presentation, those are all things interns do. When you're filling out your application, that is your presentation to USAID and to the Global Health Fellows Program, so make it really good. Don't be repetitive. We read hundreds of applications, so if you use the same example over and over in the essay and the resume, it's boring. You know, please think through the application very carefully. Don't stretch the truth. As I said earlier, these are intern opportunities, so we're not looking for tremendous amounts of experience. We're looking for what your passion is and what kinds of volunteer work you have done. Obviously, some of your academic work, especially if you're doing research papers. And don't be trite. So many of the applications say that we read last year said the same thing about public health being a right and not a privilege, and we know that. That's why that's the business we're in. So be genuine, and that's what we're looking for in the applications, and that's what the hiring managers are looking for. Now, Salaam was very gracious in telling us and saying that we did a good job on telling people about how to submit your resume. Now, when you're in school, your career counselors are going to tell you a different way to write your resume than we're going to tell you about. I'll also tell you that on our website we do have some top 10 tips for writing your resume. I'm just going to go through a couple of them this morning. Number one, don't put every single class that you've taken on the top of your resume. We see so many applications and resumes that just list classes that you've taken. That's not what we're looking for. If you're in a Master's of Public Health program or in whatever program you're in, we're not looking for your transcript. Again, we're looking for, what we recommend people do is to have a 2 to 3 line summary statement at the top of their resume that really says something like master's student in public health or whatever, international relations or whatever your master's is going to be in, or undergraduate, whatever your degree is, with special interest in, tell us your interest, family planning, reproductive health, HIV/AIDS, maternal child health, whatever, commodities and logistics. with 2 summers of experience volunteering at a whatever, healthcare clinic, serving immigrant populations, have language skills in these languages. A brief summary of what you've done. That's what we're looking for, not a list of your academic classes that you've completed. Obviously, if you've written a research paper, add that up to the top, because that's exactly what many of the internships are about, writing white papers, and having the quantitative and the qualitative research skills are very important. So again, it's a key qualifications at the top of the resume. And then you want to create a resume, but a resume is not. A resume should be a living, breathing document, something that you're updating on a regular basis. You should tailor it for the specific position that you're applying for, highlighting what's most important in that position and relating it to the experience you have. And you should identify key phrases that are industry specific and use them appropriately. Again, you look at that USAID website. It's just chock full of information. It also has a e-learning site where you can sign up for a free module. You can take modules on specific areas in health that you're interested in, and then you will know how to speak like a USAID person and know some of the acronyms. And incorporate that position vocabulary into your resume. So again, there's still time. We're not going to be posting jobs till December. So if you haven't had these volunteer experiences, there's still time to do that. There's still time to do some e-learning classes on the USAID website. So let's look. We do have some poll numbers in, and it looks like we have looks like we have about, the percentages aren't coming up on my screen, but it looks like the largest number of people that are on the phone have completed their master's or are enrolled in the master's program. We have some that are in undergrad, and it looks like about 30% are in graduate school and 30% have completed their master's degree. And sorry, I can't see the percents, but anyway. So we have a diverse group here, which is great.
Joyce, do you want me to tell you the percentages?
Yes, thank you, Star.
Okay, so enrolled in undergraduate program, there's 4%, and completed bachelor degree, 6%, and the graduate and the master's degree are both 35%, and then others 2%.
Okay, thank you, Star.
Okay.
Thank you. Great.
Do you want me to display the results for poll 2 now? Yes?
Yes. Go ahead.
You should see
okay. It looks.
So for the first one, it's 7, and then 12, 10, 35, 8, 8. Do you want to sort of talk about that?
Okay. I see now. Thank you. So about 35% are still in school, 10% currently working in global health, and 12% in domestic health. So we have a wide variety of people, both in domestic and global health. And again, don't be discouraged if you do not have international experience. This is an opportunity to apply for some opportunity to get that experience. Okay, questions and answers. Let's see how many questions we have. If you haven't already posed your question, please go ahead and do that. And let's see the questions. Okay. Let's see. Well, I'll throw this out. I think we answered this, but the person is saying, is it possible that an international student take part in these internships? And I believe she probably is asking if maybe she is not a U.S. citizen. And as Kendall mentioned, because our positions are at USAID, you must be a U.S. citizen or a permanent resident. Okay, let's see. Hello, panelists. I'm an international graduate student and currently in an MPH MBA program. I'm interested in health systems and healthcare, wondering how I could apply for a summer internship. Well, I think we just explained all that. Okay, let's see. Do any of the interns become global fellows after completing their internships? Who would like to answer that? Kendall, I think you probably can answer that one.
Sure, yeah, I can jump in there. So thanks, Joyce. It feels weird talking again since it's been so long. I've been getting used to listening to everybody else talk. So do any of the interns become global fellows after completion of their internships? Yes and no. So we, and these numbers are a little bit old, they're about a year old. We haven't been able to process our numbers for this year yet. But in the past, over the past 5 years, about 20% of our interns will have gone on to either be fellows or direct hires for USAID, or have worked for USAID in another mechanism right after their internship. The reason the answer is yes and no is because, yes, obviously the opportunity is there for any intern to go on to either, like I said, be a fellow or direct hire. But most of them will take it, they get these positions through their own networking abilities, and because a position is open, and they've used the time during their internship to the best of their abilities to network, to learn about USAID, to learn about the agency, and use that to really supplement their resume and their application materials. There is no, and I think maybe this is what the person asking was leaning towards or wanting to know, there is no tracked method. So there is no, you've done your internship and then you go on to be a fellow. We currently aren't tracked in that way, but there is, we've seen a notable mark and a notable effect upon people being interns, and that giving them the ability to move on to be fellows, or, like I said, direct hires or employees through another mechanism.
Okay. Kendall, this looks like another one for you. How many interns are welcomed into the program each year?
Sure. So, and to kind of piggyback on what Joyce mentioned as well, is that we really kind of have several aspects. So we have the main internship program, which is our summer cohort, and then we also have our on-demand internships as well. They're all based at USAID Washington. They're all direct employees of the Public Health Institute and are part of the program directly as employees, et cetera. And for our summer cohort, we welcome about 25 a year, and then for our on-demand positions, we usually, I mean, it fluctuates as the name suggests. It's ad hoc. It's as they're demanded, or requested rather, not demanded, from the agency. And we usually see anywhere from 3 to 7 a year, usually around 5 a year, give or take. So 25 every summer, and then 3 to 7 every year. And then we also have the second part that I mentioned a bit ago that Joyce mentioned were our internships that are through GlobeMed, that are kind of a separate. So if you add those together, about 100. Now the GlobeMed ones are not through USAID. They're not employees of PHI. They are through GlobeMed. They work on similar projects. They are a separate cohort, but if you add those up, about 100 internship opportunities.
Great. Thank you, Kendall. Here's one for some of the interns. What was the biggest challenge you faced when adapting to the work at USAID? What experiences most helped you jump into the new role? Who wants to take that one?
Oh, okay.
Cheryl, do you want to start? I'll go after you.
Oh, sure. That sounds good. So could you repeat the question? Sorry, I just came unmuted, and so I wasn't.
Oh, that's okay. What was the biggest challenge you faced when adapting to the work at USAID? What experiences that you've had in your background really helped you jump into the new role and adapt that quickly?
I think my work as an HIV tester and counselor really helped prepare me for my work, just because in terms of participating in research studies involved in it, it's the same type of pace of work where, depending on, you know, what's needed in terms of a research study, things happen pretty quickly. So there's always a tight turnaround. That's what my experience always was, is with writing research protocols or that type of work seemed to be very helpful in terms of this internship, and kind of gave me a foundation to jump into some of the technical work.
Okay, great. Anybody else want to answer that?
I'll take the first part of that question, and what are the challenges of adjusting to the internship. I'd have to say the enormous amount of acronyms that you have to learn and absorb super quick. Everybody speaks an acronym over there at AID, and it's hard coming from an acronym-free or not acronym overloaded environment to just quickly jump on the ball and understand what people are talking about at the drop of a hat. So that was a bit challenging. But that said, I mean, once you start understanding that, it comes easy. And then weeks later, we're talking acronyms, so then we're guilty as well.
Okay. Here's one. Kendall, this is probably for you. How should we communicate if we are interested in more than one division or area? For example, this person is interested in both maternal and child health and nutrition.
Sorry, I couldn't get my microphone working. So how do you? That's kind of a trick question, I guess. And the reason it's a trick question is because we always encourage people to apply and to positions that really represent their focus. And I know Joyce mentioned this, is that you really want to build this brand, you really want to build this focus that you have, and as she mentioned, really showing us the whole picture. Definitely when you're beginning your career, it is, it's very difficult. You don't want to, nor should you, have yourself pinned down to what you're going to do for the rest of your life. But you should be in the process of really kind of defining your overall, again, to use this phrase, I don't want to bludgeon it, but your overall focus of where you want to work. So if you have two completely separate, like say there are two positions, you have two completely different things, I would really encourage you to really check out and see, which one of those, if one is really far apart from your experience, and if one is something that you've really done, you've for example, monitoring and evaluation, and the other position might be for someone to do GIS research for HIV/AIDS. So if you've got these two positions, they could be quite different. And so I would really encourage any applicant to look at their resume, at their materials, and see which one they're really qualified for the most, and which one they would enjoy the most as well. If and it usually doesn't work out like this, but if you are completely qualified for these two completely separate things, then totally apply for them as you would if you feel completely qualified for them, then absolutely. We do allow for our USAID Washington internships, we do allow you to apply for two positions, so you absolutely can do that. And we encourage everybody to, if there are two positions that you're qualified for, please apply for them. But again, I'd like to reiterate, really, because we get that question a lot when I do informational interviews, when we speak with people that are applying, or later in the winter when it's getting the application time, and we really do encourage to really look and see which one you think really fits your desires, your experience, and your whether you're in school, supplements your schooling, or if you're currently in a temporary job or what have you, whatever really benefits that and supplements that.
Okay. Let's have some of the interns answer this one. Do applicants for the internship positions, let's do this one. What are the skill sets that are most helpful to you in your internship? Grant writing, monitoring evaluations, statistical packages, GIS. What are the skill sets that you're using most in your internship?
This is Nicole, and I'll start. For me, out of the options that you gave, definitely statistical packages. I know a few, and the contracting agency that I was working for asked me to use a specific statistical package. So I had to brush up a little bit on that one, but I would say that comes in handy. And then overall, one of the things that I liked about the internship is that once you get there, they kind of find out like which areas you're the strongest in and which areas you're open to learning more about, and then tailor your specific tasks to where you're able to contribute the most. So I had never used GIS before the internship, so they wouldn't have put me on a project where all that I did was use GIS the entire time, unless I expressed that I wanted to learn that program throughout the internship. So I guess that's my answer to that question.
Okay. Does anybody else want to chime in? Anything different?
Hi, this is Salaam. I'm mostly a research intern, and so you know, what has really helped me is the research classes that I took at school, a family planning course. But as Nicole was saying, you talk with your on-site manager as well as with people in your division to find out really what are your interests beyond the internship as well, to find out, how they can help you. They really are interested in helping you, build a career towards whether it's M&E or whether it's, monitoring and evaluation, whether it's maternal and child health, or, whatever the specifics are you're looking for, whether it's something more broader based. So it depends on the internship. I think there are descriptions with each internship. There's a scope of work, identifying the technical expertise areas that are required for that position. But it's an internship at the end of the day, and you're here to learn. So I wouldn't worry so much about coming with, an incredible amount of experience. The main part is you're coming to learn. And so just come with an open mind, and people here work with you incredibly well.
Okay. We have a lot of questions about the application process and the qualification. So do applicants for the internship programs have to be currently enrolled in undergraduate or graduate school? Kendall, do you want to take that one?
Sure. And the short answer is no. You do not have to be currently enrolled in the program. We do have a 6-month working window, because we know that some people graduate in December, some people graduate in May, and then other schools are on other schedules that might seem a little off. I know that we have some students who don't finish their schooling until middle June, late June, early July. So yes, you do not have to be currently enrolled, but we do have the 6-month grace period, if you want to give it that, if you want to call it that.
Great. And here's a question. Have you had interns that are older students, 50 years plus, with other types of experience now going into public health? So Kendall, do you want to talk a little bit about what a mid-career changer is in our world?
Sure, yeah, and this is actually one of my favorite things. These are one of my favorite groups of people. So mid-career changers are exactly what you, the person that asked this question, have described. So we have had what we refer to as mid-career changers, which are people who have worked in a non-global health industry for at least 7 years. And we've had several of those. Last year we had 2 actually mid-career changers who were in their mid to late 50s, who both worked in the healthcare industry, not global health, the healthcare providing industry, and had recently, before applying to our program, decided that their last 30 years they had been doing not what they wanted to do. They wanted to be global health technical advisors. And so they both started school separately. It just so happened that they're both similar demographics, but they both started school, and they applied, and they were actually both 2 of our 8 Uganda interns. We've had several others. Those are the ones that really stick out just because they went halfway around the world. But we've had several, and we highly encourage and highly recruit our mid-career changers to be both fellows and interns. So absolutely.
Okay, great, thank you. Does working in a resource-limited area, such as some U.S. cities, count towards international experience in the same way that volunteering does? I'll let any of you answer that one.
I'll let, if someone else wants to go first, I'll let them go. But I definitely call dibs on saying something at the end as well, because this is my second favorite topic to talk about. But if not, I'll jump in, if that's okay. So absolutely. This is, like I said, this is my second favorite thing to talk about, because it really is something that we have seen, it's been there for a while, this concept that Joyce mentioned several times. I think that maybe the person asking the question also used this phrase, resource challenge setting. That's a phrase that we're seeing really proliferate around. A lot of it's because of the recession, because we're realizing that a lot of people don't have, at least now, really don't have the time to take a year off and go around the world, or to quit school, quit their job, what have you. So we've actually seen in a lot of job descriptions this phrase pop up and sometimes supplement, but sometimes even replace international setting. And so you'll see, instead of I want you to have worked in an international setting, they'll say resource challenge setting, because at the crux of it, the basis of it all is, the reason they're asking that question, the reason job positions want you to have worked in an international/resource challenge setting, is to know that you're going to be okay in these types of situations, that you're comfortable working in them. Some people have never experienced, a setting where the power may go out in the middle of the day and you no longer have access to the internet or to your computer, or where money doesn't flow as easily, so you may have to, use a 5-year-old computer that doesn't have certain capabilities, or what have you. And so that's what they're really trying to gauge, is are you comfortable in those sorts of settings? And there are many of those opportunities around this country, in the domestic U.S., that people who do not have the time, the opportunity, the financial stability, or just financial ability to do that. So some that I always like to suggest when I'm speaking with people are, definitely there are, in large city settings, there are always resource challenge settings. If you go to certain areas, here at Washington, D.C., where I'm based, we definitely have areas that are, and certain types of work in those areas that are resource challenged. There are clinics that don't get the funding. There are, areas that really still to this day don't have stable infrastructure. And then away from those cities, there are also Native American reservations are one of the closest things that we have to really truly resource challenge settings. And then also different geographical areas. I always recommend Appalachia, which is where my family is originally from. That is absolutely a resource challenge setting. And so I recommend those places to a lot of people to check them out. They're comparatively speaking to traveling around the world, they are much cheaper, much easier, and clinics and organizations and agencies in those areas are usually more than happy to have young or mid-career changers, intelligent, bright people to come and work with them, intern with them, volunteer with them, etc. It's something that I absolutely always recommend to people to check out or to look into. It's a great opportunity that largely goes untapped.
Great, thank you. So to the interns, what are your next steps after the internship? Who wants to go first?
This is Nicole. I'll start. I'm still in school, so I am enrolled in a PhD program that's going to be about 4 or 5 years long, and I am currently in my 2nd semester. So I have a long time before I transition into the workplace. It's nice to have had the internship experience so I can add that to what I'm learning in class, and so that some of the examples that they give in class and more theoretical subjects that we talk about become real, because I have real-world applications that we talked about through my internship and that I worked with through my internship. But for me, for the next few years, I will still be in school.
Salaam, do you want to go next?
Okay. Hello, this is Salaam again. I guess I'm the only one not in a PhD program, so I'll be graduating in May, God willing. I don't know what my future plans are. I'm considering hopefully applying for a GHFP fellowship or another fellowship that I'd qualify for at the time of my graduation, but I'm really not sure, honestly speaking, what the future holds. But I would love to apply for a fellowship if I qualify, because USAID is really a wonderful place to work. As all the interns have attested to, there's incredible support for you as an employee, as an intern. Whatever level you are, I think, at that organization, it sounds like a really wonderful place to be full-time. So God willing, that's where I'd love to be. But, I'm looking also at the implementing partners that I mentioned earlier in my slides and seeing what opportunities lie there. And we'll see from there. I don't know. I have no
Great.
idea. If somebody has a crystal ball, you can let me know.
Cheryl, how about you? Is Cheryl still with us?
Yes, I am. Sorry, trouble with the microphone again. So for me, very similar to Salaam, I'm kind of looking at consulting opportunities with implementing partners. Age Tech is one consulting group that I'm looking into, just getting involved with to continue to work in global health, and specifically with HIV self-testing. It's something I've really discovered that I love while doing this internship, and really want to continue doing research as this, new novel testing approach continues to develop.
Thank you. So this is about the process. Can you give us an overview of the application process after you turn in the application? How many rounds of interviews? And is there a security screening or clearance for this intern program? Kendall.
Sure. So the process begins with applications being open in the middle of December. They're open usually for about 6 weeks. And then, as Joyce mentioned, we do have a firm end date of closing in late January. And so after that, we actually have a three-pronged process, or three-round process, rather. The first round applications are reviewed by review teams that we have set up. And what they go through is they do what we call the initial reviewing. They're reviewing to see if which positions or which applicants are qualified for the positions to which they've applied. So after that, they usually create a list of 10 to 15 applicants per position. And so obviously, if there are a lot of applicants, it might be a little larger. If there are not very many applicants, it might be a little smaller. And those we refer to as our forwarded list. And so that group of people is then forwarded to the on-site manager. And the on-site manager and their colleagues will review that forwarded list. And from that, they will pick, again, usually 3 to 5, smaller if it's a smaller group, larger if it's a larger group, to interview. And then they will then interview from that group, and from that they will pick their finalists. And I'm sorry, I think there's a second part, but I forgot what that second part was, Joyce. The question.
Generally, there's one telephone interview or a Skype interview with the candidates, and then they make their determination, right? And then we go into our process of reference check, background investigation, and yes, there is a security clearance for the interns because they do, for the most part, work, at the agency, or frequently they may work in our office or even telecommute, but they do have to have security clearance because they do access the Ronald Reagan building frequently. So let's see. From a recruiting perspective, what makes one competitive candidate stand out from another? From your experience, what makes you go for one candidate over another? Well, again, I think it's all, I'm going to take this, I think it's all of the things that we described in the presentation, that what we look for is obviously the interest, the passion, proof that the person has, done some work, whether it's schoolwork, research during their schoolwork, volunteer work in the community is looked at very highly because, if you're a student, you can't have a full-time job. So having that volunteer experience, or sometimes it's paid experience while they're going to school, those experiences are looked at very positively, as well as where has this person come from? What are the challenges that they've had to overcome? Do they understand the challenges that are present in the health issues in developing countries? You can't just read them in a book. Having that experience of living in a community that has been has fewer resources. Some of the essays tell about their own parents not getting equal access to health care, and that has fueled their passion in terms of looking for the ability to make a difference in the global health community. And those are all things that we look for. Are the internships fully funded or paid? We do have paid. They are paid an hourly wage, and it looks like most of the questions that we have now are pretty I think that we've covered most of the questions that I can see in terms of the that have come in. Somebody has asked about, is a PhD, will I be overqualified if I'm in a PhD program? We are looking at the possibility of having a pilot program for PhD students this year, and we don't have all the details on that, so I will just tell you to watch our website and sign up for our e-list, and we will have announcements about that coming up in the near future. So it looks like we've covered just about all of the questions that have been asked. And the one thing that we want to tell you is that we want you to keep in touch with us. We have a number of ways you can keep in touch with us. We have a wonderful website, and you can sign up through the website for an informational interview and for our listserv. If you are on our listserv, you will get all of the announcements about where we are, all of our fellowships, internships, what colleges we're going to be at. Pretty much everything we're doing is on our website. We have a Facebook site. We're also on, we have a LinkedIn group of global health professionals, and we do go to a lot of conferences, and as I said, we've been to a lot of colleges and universities, and we will continue to do that throughout the year. We will be at the American Public Health Association Conference in San Francisco later this month, and that's at the Moscone Center, and we are having a reception, I think October 30th, and it is open to the public. We will have a booth there the whole time. We'll do resume reviews, and we'll talk about how to apply for our position. So we do encourage you to keep in touch. As we've done all of these informational interviews and college visits, I've had a lot of people write and say, well, where are the openings? So the openings will be coming. We expect a full group of about 20 to 25 internships for the summer. And as Kendall mentioned, the on-demand internships happen as USAID needs them. And so that's why you want to stay on our e-list, so you'll find out when they're available. We really appreciate the participation today. We've really had a large number of people phone in, and we hope that this information has been helpful to you. We will be having additional webinars in the near future, and again, if you sign up, you'll find out you'll be on our e-list and you'll be invited. And we look forward to seeing your applications come in as we post the positions. Thank you very much, everyone, and thank you so much to our 3 interns who are very, very busy and took the time out to put together these wonderful presentations and share their background and experience with you. Again, thank you, and good afternoon, everybody.